Effusion today. I'm Dr. Lilach Saperstein. Welcome. I am both on Facebook and on Instagram, trying to get all of you guys and answer all of your questions. I'm going to put this down for a minute. What we're talking about now is the ear, the middle ear. The middle ear space is part of our ear, and lots of times that part of the ear can fill up with fluid. You might have heard this. You might have seen, oh, the child has fluid in their middle ear, or they have fluid in their ear. They need ear tubes. Their hearing is fine, but they're not hearing so well right now. It's kind of this misunderstood part of hearing loss and of our hearing tests. And I've been getting a lot of questions from my friends and from some of you guys on Instagram and some of my followers all about, like, how do we understand these test results? How do we know what to do? All right, so let's start talking about it. We have three parts of our ear. The outer ear, that's just this piece, and the ear canal are the outer ear. Then there's the middle ear, which is behind the eardrum and including the space with three little bones in there, and that space is filled with air. That's the middle ear space that we're going to be talking about a lot today in this video. And then there's the inner ear space. That's where the cochlea is. And the cochlea has little tiny hair cells, and that's filled with fluid all the time, kind of like a little ocean with these little hair cells that move in response to the sounds, and that connects up to the nerve, up to the brain, and that's how we hear. So the sounds need to go through the entire pathway from the outer ear, the middle ear, the inner ear, and then up to the brain. And so today we're going to focus on the middle ear. What happens when that middle ear space, which is supposed to be filled with air, gets filled up with fluid? And where does this fluid come from? It usually comes from the nose and the back of the throat, which are all connected, and then it goes up the eustachian tube from the back of the nose and the back of the throat up to that middle ear space. I'll show you that in the picture so you can get a sense of the anatomy. So here, backwards. Okay, so we have this ear, that's the outer ear and the ear canal. There's the eardrum. Here's the three little bones, and those three little bones are in this middle ear space, which is filled with air most of the time. But it connects through the eustachian tube down to the back of the nose and the back of the throat. And if this is clogged, then this whole space isn't getting aerated, isn't getting air into it in circulation, so this space can fill up with fluid. Okay, so that's where we are, and that's what we're talking about today. So sometimes what we see in practice is a child who behaves, you know, they behave as typical, they have regular hearing, and they seem to be hearing okay, except for sometimes you have to raise your voice a little bit, or except for when in a crowd with other kids, or in the classroom, they're having trouble in the classroom, but in one-on-one and at home where it's maybe more quiet, they're doing fine. So it can sometimes lead to a mild hearing loss, where sounds need to be made a little bit louder just to get past this fluid that's blocking the sounds from going in, but in overall the system is still healthy and still functioning. So that's one way where we typically see people come in and say, well, my child's been saying what more often recently in the last couple weeks. It's usually connected to when they're coming in, they have a stuffed nose or some kind of upper respiratory infection. Other times that we see this is when it can be a little more severe, when that fluid in the middle ear space isn't just fluid that's taking up space, but then that fluid gets infected. And that's when you're talking about an ear infection, where a child will probably also maybe have a fever or be really unwell, like not themselves and groggy and sleeping and fatigue. And that's usually when people will head over to the pediatrician. So what's tricky is that when it's an ear infection, we kind of see it and we know it, and people go and get help for it and get care and treat it medically, right? But sometimes there's just fluid without any other symptoms, and you kind of have this, what child not being totally as attentive as they usually are, but they're doing fine, they're healthy, right? So how would we know that they have fluid in their ears? Well, that's where the audiologist comes in, because a pediatrician or an ENT or any other doctor can look in the ear with a light, with their otoscope, and they can see the eardrum, and they can sometimes see if the eardrum is red, if the eardrum looks cloudy. They can see that something is off. But in order to really get a good measurement if the ear is filled with fluid or not, then that's something that an audiologist has the tools to do, something called a tympanometer. Tympanometer is a kind of device, an instrument that typically audiologists use to have a measurement of the middle ear fluid. It's really a measure of the movement of the eardrum, but what we can see through the movement of the eardrum is if there's something blocking the eardrum from moving, like if behind the eardrum is full of fluid. So that's why tympanometry, if you've ever heard that word, getting a tympanogram, that is the exact measurement that we can get to see if there is fluid behind the ear space, behind the middle ear, right? Behind the eardrum in the middle ear space. Okay, now the second thing that happens at the audiologist and by a hearing test is getting the thresholds, finding out at what level does this child respond. So let's say we say a couple of words and we're going to keep saying, you know, ice cream, baseball, popcorn, these kind of two-syllable familiar words that kids will know, sometimes pointing to the pictures if they're not speaking. And we're going to get them to respond and ask them to tell us at what level they can hear it, and the audiologist will keep changing the volume that they're presenting the sounds at and get a threshold. So, okay, let's say they can hear it right now. Let's say I'm speaking at maybe around 50 dB in the decibel, how loud I'm speaking. And then so we'll go quieter, we'll go to 30 dB, we'll go quieter, we'll go to 20 dB, and we'll try to see at what point is the child going to understand, you know, and respond and hear us. And so maybe 10 or 15 would be a normal, typical value for a child with typical hearing. 10 dB, 15 dB in response to speech. But with someone that has fluid in their ears, we can see that number going up, which means the child isn't really hearing us until 30 dB, 35, 40, 45. It can go up, meaning that they need the sounds to be louder before they can hear them because there's something blocking their sounds from getting in. Okay, so when we're talking about a speech reception threshold or an SRT, then you might see that on your child's report, an SRT of 30, right? That's in the level of a mild hearing loss because we'd like to see that number at 10 or 15 in decibels. And then the same thing goes for different kinds of sounds that we play within the sound field with speakers, sometimes with lights, sometimes with a game. And over there also, we'd like to see responses around 10 or 15 for children at the different frequencies that we test. And we've talked about the audiogram in other videos, and we can definitely talk about that more. If you guys have questions about that, feel free to leave questions or comments here on Instagram or Facebook. And so what you want to look at when you look at the audiogram is to see where are the responses coming in. Are they coming in around 10 to 15 or good and normal? Anything up above that, we're starting to get into slight hearing loss, mild hearing loss, even moderate hearing loss. And that's the gist, the super simple explanation of how the hearing test results might look when there's middle ear involvement. Something going on with the middle ear for someone who's hearing is typically normal. And then another important thing you might see is bone conduction. Bone conduction means that we put a little vibrating headband, a little instrument on the mastoid, the bone of the ear, right? So there's a bone, part of our skull, and inside of it is the parts of the ear that can hear. And so if we put something vibrating right back here, we can directly stimulate the cochlea and then the nerve, skipping anything that's going on in the middle ear space, anything that needs to conduct the sound in. So when we do the bone conduction testing, we're really getting a measure of how the cochlea is hearing, how the nerve is hearing, and when those results are normal, up at the top of the graph, you know, at 5 or 10 dB, but then when we go in through a headphone or through the speakers and we're getting a lower response at 30, 40, 50, that's when we're seeing a conductive hearing loss, a difference between the bone, which is normal, and the air, which is too much lower than the bone. And this is called an air-bone gap because there's a gap between the bone results and the air results. I do want to let you know that it can be confusing when you get these results and when you're finished being at the ENT or the audiologist and they've just like said all these things to you and you might not totally understand or know what to do next. And that's okay because it is new and complicated and lots of words that you might not be familiar with. So you can always reach out to me, and one of the services that I offer is counseling to discuss with you what the results mean You send me the results, and then I review them with you and tell you what your options are, what you're looking at, and any other questions you would like me to answer. So you can always be in touch with me about that. Are there any questions? I see a couple of you over on Insta, a number of you on Facebook. You can always reach out to me. And if you're watching this in the replay, hi, and thank you for watching. You can also leave comments below, and I'll get back to you later. Thanks for joining me today on this little mini lesson about middle ear fluid and conductive hearing loss. And let's just mention that sometimes the treatment for this issue, if it's a chronic issue, is getting ear tubes. And that means making a small little hole in the eardrum and putting in a little tube there to help with the aeration, the ventilation, so that it can become clear fluid and the middle ear space can be full of just air. Okay, and then there's air going from the outside of the ear to the inside of the ear if it's not going out through the eustachian tube in the regular way. Thanks for learning with me today. I'm Dr. Lilach Saperstein. Learn more at allaboutaudiology.com or the All About Audiology podcast. Bye.